Good evening, everyone, and welcome to Congresswoman Houlihan's telephone town hall focused tonight on vaccines in Chester and Berks counties. I want to thank everyone for joining us. At any point, if you have a question throughout the town hall, please press *3. So again, at any point, press *3 to ask a question. You'll be transferred to a member of Chrissy's staff, and they will take down your question and enter it into the queue. Given that we have over 1,000 people on the line already, please note that if we aren't able to get to your question tonight, our office has a policy that we will give you a call back with an answer or directions on how to get an answer within 48 working hours, okay? So with that, I'd like to hand it over to Representative Houlihan.
Thank you, Connor, and thank you, everybody, for joining us tonight. I hope you all are well and safe and healthy. We are tonight going to be focused on vaccines. We are now about 15 months since our first case of COVID-19 was recorded in the United States, and to say that it has been difficult would be certainly an understatement for all of us. Our community here has been through so much, and we've lost loved ones to this virus. Our economy has gone down and forced people out of work. People are still processing the grief and the trauma that has been brought on by this really unprecedented historical tragedy. But through it all, our community has demonstrated its resilience, and I continue to be inspired by each and every one of us as we work together to make this what I hope is the last chapter of this pandemic. Your patience and your care for one another as we've observed public health guidelines has really made a huge difference. It's something that I talk about across the country and down in Washington all the time. And I'm happy to report at this time that over 40% of Pennsylvanians have received at least one dose of the vaccine. So our Commonwealth is now ranked number 11 in the country for first doses, which is an enormous improvement for those of us who have been following along. In the beginning of the rollout, I heard from many of you about the lack of vaccine availability in Chester and Berks counties. And so I immediately worked with our delegation in Congress and the Biden administration and with Governor Wolf and his administration to highlight the dire need in our community, and we were successful in supplementing our supply. All Pennsylvanian adults are now eligible to receive a vaccine, which is a huge accomplishment considering where we have come from. For my part in Congress, I've been working on policies that will help us to get shots in arms safely, quickly, and effectively so that we can jumpstart our economy, create good-paying jobs, support our hardworking Pennsylvanians like all of you all who are on this call. And most recently, I helped to pass something called the American Rescue Plan, or the ARP, which is a comprehensive package that will help us crush this virus once and for all. Some of the provisions that I fought for on our behalf in our community were a national vaccination program that includes setting up community vaccination sites nationwide, many of which are right here in our district. $3 billion towards local initiatives to strengthen vaccine confidence, $330 million for our community health workers, particularly aimed at addressing the disparities in access to COVID-19 related services, including vaccines. Crucial support for the hardest hit small businesses, particularly the smallest of small businesses with EIDLs, or EIDL loans, which stands for Emergency Disaster Loan Grants, expanded PPP eligibility, Paycheck Protection Program eligibility, and much more. A nearly $130 billion investment in school reopening and making up for lost learning, direct cash relief that is provided for Pennsylvanians following the $600 checks that many were able to receive in December. We were able to work to get new $1,400 checks to Pennsylvanians to complete that $2,000 stimulus that was promised before the end of the calendar year. This piece of legislation also provides direct housing assistance and nutrition assistance for 40 million Americans. It supports 27 million children with an expanded child tax credit and 15 million low-wage workers through the Earned Income Tax Credit as well. This piece of legislation also infuses $40 billion into the child care industry to help make sure that child care centers are able to remain open and help families who are struggling with being able to pay for child care. It also provides a paid family and medical leave provision for federal workers and paid leave tax credits to help many more people, particularly women, be able to stay in the workforce. And vital resources to protect the jobs of our first responders, our frontline public health workers, our teachers, our transit workers, and other essential workers. I'm really proud that this package has earned overwhelming support from Pennsylvanians across the political spectrum. Democrats, Republicans, and Independents have all been enormously receptive of this really important piece of legislation, now law. But the vaccine remains our top line of defense against this virus, and I urge you all to please book an appointment. This is about protecting ourselves and about protecting the ones that we love. And I know I speak for all of us in that I want things very much to be able to open back up safely and quickly. I very much, as I'm sure you do, want to return to some semblance of normal. And we have the capacity within reach to do that. And I know that this community will step up and do its part, as we always have throughout this entire pandemic. So today on this call, I'm joined, thankfully, by local health experts who will be able to talk to us with a degree of expertise about the vaccine situation here in Chester and Berks counties. So here on the line, we have Randy Padfield, who's the Director of Pennsylvania Emergency Management, the Pennsylvania Emergency Management Agency. We have Gene Franklin, who's the Director of the Chester County Health Department, and Brian Gottschall, the Director of our Berks County Emergency Services. And each one of these experts has been on the front lines of this pandemic since the very beginning. So I really couldn't be more grateful for their leadership during these really trying times. So after each of our guests offer their opening remarks, we're going to be transitioning to a question and answer portion. And at any point you do have a question, please, as Connor mentioned, press *3. And we will do our really very best to make sure that we get to all of our questions, but we do have quite a few people on the line today. And so as Connor mentioned, if we are for whatever reason unable to get to your question, a member of my staff will follow up individually with you within the next 48 hours. And as always, I ask that we have these conversations in a very civil and decent manner. We are all here for the very same reason, because we care about this country, we care about each other, and we care about our families, and we care about the importance of access to accurate information. So with that, thank you, and I'd now like to hand it over to Randy Padfield for his opening remarks.
Thank you, Representative Houlihan, and I'd like to thank you for the opportunity to participate in this evening's town hall. Events like this are really critical, as you indicated, to be able to get the proper information across to individuals and to be able to answer their questions, and we look forward to be able to do that in multiple venues. We understand that the COVID-19 pandemic has been trying for many individuals at many levels, and individuals have lost family members, and it's hard to find somebody who has not been impacted in some way, shape, or form by either the virus itself or by the impacts from the mitigation measures. As you indicated, we are in a much different location right now relative to the vaccine becoming available, and we have a brighter future ahead of us, and it has changed significantly even in the last week to 2 weeks with the amount of vaccine that is available and the access to the vaccine. The COVID-19 pandemic response has been complex, to say the least. From our agency's perspective, being in emergency management, we are taking more of a backseat role in this, as that it's a public health emergency, and really the Department of Health from the state level and even from the federal level with Health and Human Services are really leading the response. And FEMA, or the Federal Emergency Management Agency, and our State Emergency Management Agency has really been in a position to be able to bolster and provide support where necessary and close any gaps that are needed. And it really takes all levels of government working together to be able to realize a common goal. And we've been doing that throughout the entire response. Many times I commented, especially to the emergency managers and the other stakeholders that we interface with, that it is going to take all of us working together to be able to defeat the virus and be able to get through this. And it will be the most complex operating environment that many of our emergency managers and others that are involved in the response have ever operated in throughout their entire career. We appreciate everybody's input and appreciate all, everyone working together to be able to realize the goal. Throughout the response, we were always hopeful that we were going to get a vaccine a lot faster, to be able to bring an end to this. And now we have the light at the end of the tunnel. We understand that it has been a complex rollout of the vaccine on multiple levels. And there has been information gaps, and there's been information that has changed rather rapidly. And trying to communicate that has always been a challenge, to be able to get the right information to the right people so they can make informed decisions. But ultimately, everyone is involved in making this better, whether it's just following public health practices of washing your hands, wearing a mask, and following the guidelines that are out there, to doing your job to be able to get access to the vaccine now that we indicated that everybody is available to be able to, that's greater than 16 years of age, to be able to receive the vaccine, which is really critical. At this point in time, we've seen a significant shift in, as I indicated, the last week and a half. We've seen a lot of frustration relative to the vaccine. We know that a lot of that dealt with not having enough vaccine available, and that was an issue not only across the state but also across the nation. But we knew at some point in time that was going to get much better, and then we would run into a situation where the resources to be able to provide the vaccine and get it into people's arms was going to be a concern. Today, our agency is assisting vaccination sites across the state with any needs that they happen to have, and that includes clinical and non-clinical staff. We have the National Guard deployed to about 5 different vaccination locations throughout the state to be able to augment existing staff from healthcare systems and other healthcare entities to be able to provide vaccinations. We've seen the numbers significantly increase across the state, and we're making significant headway, but there's still a lot that needs to be done. Over the last week and a half, we've seen a significant shift from a demand on appointments to now having open appointments. And that happened relatively quickly, and actually a lot faster than what we anticipated. We anticipated having a significant need for high throughput clinics for a number of weeks until we were able to get to the point that, we had open appointments. And that's happened a lot faster, and that is consistent with what we're seeing in a lot of other states. Now the hard work begins, and that work is actually getting vaccine to a lot of the other underserved populations, the homebound, and other communities, and really making sure that they have good access to that vaccine and really combating vaccine hesitancy. And that's why meetings like this evening and town hall meetings are really critical, to be able to get that information across, and really the need to be able to get as many people vaccinated as we can to be able to get this virus behind us. So again, I appreciate the opportunity tonight, and I'll turn it back over to you.
Thank you so much, Randy. And again, that was Randy, who's the director of the Pennsylvania Emergency Management Agency. And next we have Jean Franklin, who's our director of the Chester County Health Department, for her opening remarks. Thanks very much, Jean, for joining us.
My pleasure, Representative. I couldn't echo your words, Representative, and certainly Director Padfield's comments. You both said it brilliantly. So maybe what I'll open up with is just kind of giving the picture of kind of where we're at in Chester County. We still meet with our school leadership every week, and we're fortunate that in Chester County we opened that up to our Berks County neighbors as well. And really why we continue to do that is because we knew we were going to have to get into that age 16 to 17-year-old group, and really schools are a great avenue for that. So we are promoting that in our schools because, they're limited to one vaccine right now, but we don't want them to feel limited to access. So in addition, we have done some strong analysis of the data, and as frustrating as it has been, it's pretty incredible to be able to tell you tonight that in Chester County, of all individuals, regardless of their willingness to get vaccinated, who are 16 years or older, as a county, we have vaccinated 66% of our population that is 16 years and older. That is incredible considering we began in January in earnest. So I echo what our friends at the emergency management, perspective is we're not at risk now for, having enough vaccine, we're really in that last mile, and we all know the marathon, the last mile is always uphill, and it's really going to require that personal touch, getting out into the community, having smaller teams in the community, having conversations before someone chooses to make their decision about it. There's lots of different reasons why people may not have gotten a vaccine now, and we're just going to work on all of those. So we have an equity plan that has been in place and in operation for quite some time, and now we're moving more of our resources into that equity plan because we do have ample appointments available. We have ample staff vaccinating, et cetera, because through the representative's assistance, we've gotten a significant increase in vaccine availability. So not only thank you for that, but I want to make sure folks know there's plenty of opportunity to find an appointment. If you cannot find one or do not have the technical resources to go online and do it, pick up the phone, call the health department, 610-344-6225. We'll make the appointment for you. We do not want anyone to feel like they are strapped because they don't want to use a computer, don't have a computer, don't have a printer. You don't need any of that. We need to make this easy. So part of our outreach, so we're calling them equity outreach, and it is to those hard to reach or undecided individuals or those who are already in the disparity, whether they have been greatly impacted by COVID or they have natural disparities for it. So we're not doing that alone, much like you've already heard. We can't do it alone. We are championing it with a lot of local organizations who already work in our communities. So we don't need to repeat, we need to empower them. And they are more than willing and eager to help in that, whether it's messaging, getting people's rides to where they need to, or letting us know who needs us to truly come to their home because they are homebound. So that is another aspect of our outreach right now. It's already underway. We have 2 teams that are out doing at-home vaccinations. We are signed a bunch of other agreements to have more teams, and hopefully that begins as early as next week. We have a few steps we do before we put someone on a calendar, or on a schedule, I should say, for that. And that's really just validating you haven't already been vaccinated and there are no concerns with you getting vaccinated. And then we get you on a schedule and we have a small team come into the home. We won't just do the individual who is the individual who cannot travel. If they have a caregiver at home or other children who are of age, absolutely we'll do the entire household. So if you have been on our list and have not been reached out to yet, have no fear. You are on our list. We got a little bit slower start than we preferred because we were waiting for enough vaccine because we didn't want to start and then have to stop. We've cleared that hurdle, so we are making those outbound calls. As much as I hate to ask for your continued patience, but if you're still wondering, certainly send an email or call the health department. So 610-344-6225 or email cchd@chesco.org, and someone will certainly get back with you. I could go on for another hour, but I want to be respectful and turn it over to our next speaker and get to some of your questions. So thank you, Representative. Pleased to be here.
Yeah, thanks, Gina. And we will definitely make sure we give that information again as well if people don't happen to have a pen or paper available. And with that, we will turn it over to our last guest for his opening remarks, Brian Gottschall, who's the director of the Berks County Emergency Services Group. Thanks so much for joining us, and I'll turn it over to you for some brief opening remarks.
Congresswoman, thanks very much for the opportunity. I know that we are running a little long here, and I know we want to get plenty of opportunity to directly answer questions from the public, so I will try to go at a rapid clip. I think the first and most important thing to say is that this is not over. I'm a member of the public, just like I'm a public servant, and as a member of the public, I look around me sometimes, and I think we've been doing this a long time, and things are looking better. Aren't we at the end yet? And we really want to enforce for folks that we're not at the end yet. We really need to continue to fight the hard fight, keep in place the mitigation measures, make smart decisions as we conduct our lives, and kind of not lose sight of the goal here in the last few minutes of the game, if you will. So moving on from that, getting into vaccine, which is, of course, the thing that everybody is very interested in right now, I'll echo what we heard from the other speakers, that we very rapidly went from a place of people complaining that they weren't able to find opportunities to receive vaccine to literally almost overnight answering calls from our providers saying that they had vaccine to give and couldn't find people to give it to, and could we help them to find groups of people that we could get enrolled in their vaccine clinics. And we respect that the decision to get vaccine and what type of vaccine you're going to receive is a very personal, important medical choice, and we certainly don't want to be perceived as being in a position of trying to talk people into something that they don't feel comfortable with. But what we do hope is that people will seek out the information sources that are appropriate and accurate in order to find out information, not listen to an uninformed friend or some comment that they saw on social media, but really go to the sources, go to the State Department of Health, go to the CDC and understand all the truths that are out there about the vaccines and the statistics, and really educate themselves to make these decisions for themselves and their family. With that in mind, I want to mention the page that we're attempting to aggregate folks to in Berks County. It's a very simple URL, doyourpartberks.com. doyourpartberks.com, all spelled out. And there we're trying to give people an easy source of information for these types of things, and most importantly, provide them a single source of redirect to clinics that we're aware are operating in Berks County where they can sign up to receive vaccine if they choose to. If folks don't have access to technology and would like an easy way to do it, we also have an 800 number that is being answered at our Berks Cares Vaccine Call Center. That number is 1-888-712-2772. Again, 888-712-2772. Those phones are being answered Monday through Friday, 9 to 5 right now. Our commissioners are very committed that if we see traffic that indicates that we need to open those lines longer, more days, we're prepared to do that, but we really want to understand what the public desire is for this type of access before we make those commitments. Through either of those places, it's very easy to find vaccine right now in and around Berks County. For those that are able to travel, the state has opened up a regional vaccine center at the Park City Mall in Lancaster in cooperation with a number of partners there. There's a considerable amount of vaccine made available through that source almost every single day. But if you don't have the ability to travel to Lancaster, if you don't choose to travel to Lancaster, there are plenty of opportunities in Berks County. As I said, we have providers who on a regular basis are not able to fill the clinics that they're opening up and are now becoming very concerned about their ability to continue to receive vaccine due to the fact that we're not able to administer it as rapidly as we would like to. The other thing that the availability of vaccine has opened up for us is the capability in the county to open up a kind of county-sponsored public clinic. This is an effort that we've been working on for some time, but due to the inability to have a consistent supply of vaccine available and not wanting to take vaccine away from the other providers that were doing a great job getting it out the door, it didn't seem prudent for the county to move in that direction. However, now that the vaccine supply has opened up, we are prepared to do that. Again, the information with respect to that will be available at the doyourpartberks.com website or at the 888-712-2772 number. The last thing I want to touch on, as I know it's been a very important topic, is homebound individuals. Our area agency on aging has been answering calls from individuals that they regularly work with who are having difficulty getting out of the house to get to a vaccine center. And we're working with our community partner, the Berks Community Health Center, our federally qualified health clinic in Berks County, to try to meet those needs. It's a very difficult process, as you can well imagine, having to send a provider out to somebody's home, having to stay with that person for 20 minutes for the required observation period, and then pack up and move on to the next person. Very resource intensive, very low volume operation to get vaccine out the door. However, Now that we've seen the demand for vaccine somewhat curl over at the top and we have additional resources available, now's the right time for us to be able to resource that. And as I said, our partners at Berks Community Health Center have already begun that process. They were given a little bit of a kick in the teeth with the Johnson & Johnson hold, as that was the vaccine that they were intending to use for that purpose, but fortunately they were very resourceful, able to shift gears and move over to the Moderna product to continue the program that they had started. Of course, it makes it a little bit more complicated, as now there's a second visit necessary to that person's home to get them their follow-up dose. But we are committed to moving forward with that process. Individuals who are truly homebound, and when we really ask people to look at this and say, look, are you really homebound, or do you just prefer not to go out? Because if you just prefer not to go out, but you do sometimes when you have to for doctor's appointments or the supermarket or something like that, we would ask that you really do try to make your way to one of the established clinics and receive your vaccine in that manner, and allow this community resource to be reserved and made available for those folks who truly are unable to get out of their homes, and this is their only means to go about getting vaccine. Those folks can continue to reach out through whatever advocacy groups they use normally, such as the Area Agency on Aging, the Department of Mental Health and Disabilities, if they have relationships there, or they can also feel free to call the 1-888-712-2772 Vaccine Cares Berks Cares Call Center, and someone there can help you to make that connection to receive that vaccine in your home as a truly homebound individual. So, Congresswoman, I'm going to pause there just so we can get plenty of time for question and answers and turn it back to you.
Thank you so much, Brian. And with that, we will take the rest of our remaining time to field questions from folks. I would like to emphasize that we are in a really important time in terms of the trajectory of the availability of vaccines, where they are fortunately beginning to be available to everyone. And I know that there is a lot of conversation here about making sure that there's equitable access and making sure that those of us who are homebound have access. But I also want to emphasize everyone is able to access a vaccine now. And for all of the people who may be on the line who feel as though they've been trying to politely wait their turn, it's your turn. And please make sure that you take that opportunity to get vaccinated, because even though I know you may be reticent to get your vaccine because you're trying to make sure other people have their opportunity, you will be helping those people if you indeed do access that vaccine opportunity as well. And so with that, I will turn it over to Connor. Reminder, please, to hit *3 if you do have a question, and he'll go ahead and let us know who has been asking us questions during this time of opening remarks.
Perfect. Thank you, Representative. We do have a number of questions. As the representative noted, please press *3. And I'm going to remind our panelists for our answers, we'll try and keep these short as we can, make sure we answer the question, but just to get through as many as possible. So our first question is from Missy in Shillington. Missy, you should now be on the line.
Hi, Chrissy. How are you tonight?
Good, thank you.
I was just wondering, you guys keep really pushing it, but you're not really making me feel confident in taking something that hasn't been fully approved by the FDA. It was approved for emergency use, yes, I know, but how do we know what the long-term side effects of this are really going to be? It's just kind of concerning that nobody talks about that. We kind of just brush over it. That was my question.
Thanks, Missy. Connor, who should we turn that over to?
Yeah, I think we can turn it over to Director Padfield. Could you speak to that?
Sure, I can start off, but I think it may be better served by someone from the health department. Maybe Jean can actually hop in. So, I think that's a valid concern. We've heard that concern from multiple people, and I think the rigor that the process the rigor of the process that has been used to be able to vet these vaccines is commensurate with the rigor of the process for any other vaccine. I think the goal is really to take a look at, and it's really balancing the efficiency and the process to be able to get the vaccine out, and making sure that it is definitely safe to do so, with making sure there's a rigorous process behind it to make sure that it is safe. So I think a lot of the things that we're seeing right now, especially with how rapid it's being rolled out, and the follow-on studies that we're seeing with the adolescents and those types of things, that is the kind of evolution of the vaccine to be able to really get it out and get it to the folks that need it the most. And really the goal is to stop the transmission of the virus and really stop people from transmitting it to other people that are more vulnerable. Every day we look at it from the state perspective, we have, fatality counts every day. So people are still going to get infected. We have a concern with the numbers right now that they're really plateaued, and we're seeing, 3, 4, 5,000 in a day, new infections. But those numbers of folks that are being affected are in different age populations right now. So, I understand there is a concern for that. What I usually tell people is, go in and read all of the information, as Director Gottschall indicated. Go to the CDC website, take a look at all the information that the ACIP has put out when they review it, and take a look at what the indications happen to be. I understand that the Johnson & Johnson vaccine issue is concerning, but that is really, 1 in a million right now when we take a look at that. And there is a predisposition for blood clots that is a lot higher in other populations with certain risks. So I think it's really balancing that. But Jean, feel free to hop in here from a health department perspective.
Certainly, and I'll just add a little bit to it. So, it really comes, I respect it comes down to an individual's risk tolerance. What I want to share is the vaccine process that has been followed to get to an EUA, the emergency use authorization. It was sped up, not shortcutted. So because the government was able to fund it, the manufacturers and researchers and scientists sped up the process. They didn't cut out steps. So I feel like we've been able to do this for a long time, and lots of our, FDA approved, medications and vaccinations. This pushed it. So that's one point I want to make sure you understand. Absolutely read up on it. And then, the other piece of it is these are not entirely new vaccines. They're not, while it's a new virus, we are leveraging the research, the technology, and the vaccine strategy, not from the distribution, but from the making of it and testing of it that we have used for a long, long time in all of our vaccines, to include our influenza vaccine that helps us through the flu season. So that is important to understand as you make your decision. So I hope that's helpful.
And thanks, Jean. And what I would conclude with is that one of the reasons why we try to hold these kinds of telephone and Facebook and hopefully soon in-person town halls about these kinds of things is to do exactly this, which is to bring truly experts to the conversation. And I really appreciate your insights, Jean, as well on this particular issue, because I'm a policymaker. I'm not a scientist and not a doctor. And I'm grateful for the recognition that this has been an accelerated process, and it's because of a lot of people who've been pushing a lot of resources in the right direction. But this is definitely something that we need to understand, that the best and brightest minds in our scientific research community have been working towards. It is building on the shoulders of research that has happened before. These are obviously ultimately personal decisions that have to be made, but I want to make sure that we're bringing the best information to you guys that we possibly can.
Perfect. Missy, thank you for your question. And our next question comes from Phyllis in Westchester. Phyllis, you are now on the line.
Thank you. I have an elderly neighbor. She is 93 years old. She has not been vaccinated because she hasn't left her house. Her son tried calling to get some help to get her an appointment because she doesn't use the internet, and he was directed to the internet. She's 93. Can someone really just call and make an appointment for her with the health department? I'm very concerned for her. and other seniors who may really not have access to the internet and not know how to get an appointment? Thanks.
And so, thank you so much. And with that question, Connor, maybe we could go back again to both Berks and Chester counties and remind people of the phone numbers that we have there.
Yeah, so just to encourage everyone right now on the call, if you do have paper and pencil handy, this would be a great time to take it out. And why don't we start with you, Brian, for answering that question in respect to Berks?
Thanks, Connor. So the two things we'd like people to write down, depending on which type of access they prefer. Number one, doyourpartberks.com is the website, and the phone number for the Berks Cares Vaccine Call Center is 1-888-712-2772.
And Brian, are they able to make an appointment for the question about not being able to access the internet? What should people in that situation do in terms of making an appointment?
Yep, if they already have a pre-existing relationship with a social service agency at the county, like with MHDD or with the Area Agency on Aging, they can feel free to reach out to their normal caseworker or advocate that they work with there. If they don't have those relationships or aren't comfortable doing it that way, they can call that 1-888 phone number that I just provided, and someone there will take their information and then we'll reach back out to them to assist them in doing that.
Perfect. Thank you so much. And Jean, the same question to you, please, for Chester.
Absolutely. First, I want to thank you for caring so much about your neighbor, because this is exactly what the representative got at in the beginning. We have truly cared for each other. Connor, if you can take her information, I'd be happy to have someone personally call out. For those who also need assistance, we'd love for you to call 610-344-6225. That is our regular everyday health department number. It will ask you if you want an appointment, press here, and we have an entire call center that can literally take your information, schedule you while you're on the phone. So her son, the neighbor, anyone can call, or you can call aging department. There are multiples, but the easiest is probably to go through the main number that I just gave.
Thank you both. And Phyllis, we have given your contact number to Jean as well, so she will have that. All right, moving right along here. The next question comes from Bernadette in Chesterbrook. Bernadette, you should now be on the line.
Hello, everyone. I'm glad I could get through with my question, which is, I'm a bit concerned about the younger people, the students. I know that I think I'm correct in saying that from 16 on up, they can get vaccinated, but I'm concerned about those even younger and up down into first grade and kindergarten even. So I don't know, does anyone have a plan or know of a plan that's in the works for those ages?
Thank you so much for your question, Bernadette. I think I'll turn it over to Jean O'Brien for public health experts on sort of the availability of vaccine and progress in terms of use.
Sure, I'll start with that. So we know, and we track this very closely, we know that the Pfizer vaccine that is currently available for 16 and older is pushing through in their process to get emergency use authorization for 12 to 15. So once they go through that process, it's a matter of that being made public, and then we get to start to invite our 12 to 15-year-olds to get vaccinated. The most wonderful thing about our younger community is our schools are so invested in helping to get the youth vaccinated. And I'm going to venture to say this is irrespective of the county that you're in. So they're poised and ready, are willing to offer their buildings during the summer so we can, and volunteer with us, so we can bring those in should that authorization for the younger ages come to us that soon. For ages younger than 12, those studies are still out. There's different processes for different age groups. So that's where we turn to the FDA and make sure they are dotting their I's and crossing their T's. But certainly that 12 to 15-year-old group, we should see come sooner than anyone younger than that. And the importance of everyone else who's older than these age groups of getting vaccinated is to essentially wrap a vaccinated hug around those who can't get vaccinated and to protect them. So that's why we're also asking, those of age to, do their homework and make their decision about getting vaccinated. So thank you.
Thank you so much. All righty, moving right along here. Thank you for your question, Bernadette. The next question comes from Alfred in Phoenixville.
Yes.
Alfred,
hi, good evening.
On the line. Good evening.
Hello,
sir.
good evening. Thank you, Representative Houlihan, for having this town hall and all the important guests that you have. My question is, and I should preface this by saying that if somebody's having a hard time getting an appointment, they could call a local pharmacy and get on these waiting lists at local pharmacies, because that's how Diane and I got vaccinated. We also were registered on Chester County Health site, but the pharmacy actually called us and said that there's others who had gotten previous vaccines, so they moved us on up the waiting list. My question, and this is perhaps for Director Paddock or Jean or Brian, anyone, are there any updates on the Johnson & Johnson, the clotting issue? We happen to take that vaccine, so we have a special interest for those who are anticipating the vaccines. Are there any updates? I know there were 6 cases out of 6.8 million. Is that an acceptable odds or probability?
Thank you, Alfred, for your question. And I know a number of people in our queue also had a similar question. So, Brian, why don't we start with you on the Johnson & Johnson situation?
Well, thanks. I think, Connor, let me be clear that I'm not a public health expert. I'm the Director of Emergency Services in Berks County, but I'll certainly do my best to answer based on what I've read from reliable sources, and in particular an Oxford study that was done that looked at 500,000 people who, in fact, had COVID, and what the study established is that there was actually a risk of this CVT phenomenon in 39 out of a million patients who had COVID. They then looked at some of the vaccines and saw numbers that were approximately an eighth or a tenth of that number. So as I think a number of us mentioned early on, we all certainly respect that it's a personal decision. It's about risk-benefit balance. But I think it's important to recognize that the CVT, the types of clot that they were talking about with respect to the Johnson & Johnson vaccine, does have some prevalence in folks who have gotten COVID without being vaccinated, and has also shown some presence in folks who have received other vaccines. And interestingly, the prevalence of the situation in folks who have gotten COVID is actually higher than with any of the vaccines that have been identified. So again, I'm really just reiterating factual data that I've processed. I don't want to go past that and get into the medicine behind that. I would defer to Chester's health director with respect to a more medical answer.
So
thank you, Brian.
We're going to find out a lot more
Go
tomorrow.
ahead.
Yeah, we're going to find out a lot more tomorrow because the ACIP, which is the leading agency that is not grounded just in government officials, it has experts from across the country. They're meeting tomorrow on just this very topic all day. So we expect in the evening to have some further updates and guidance, whether that guidance is to continue with the pause or that guidance is to return to using J&J and perhaps with some modifications to how it's used or whom to whom it's offered to. We do know that there's a seventh individual. There may be others who have come forward, because part of the review tomorrow is also looking at other healthcare professionals who have reviewed their patients, not realizing it may have been connected to a vaccine, and have submitted their data to do the chart reviews, et cetera. So there is a lot that has gone on over the past week, and tomorrow is really where it all comes together. So let's stay tuned with that. Certainly, if you've passed the kind of that threshold of number of days since your dose, you should be in the clear. But I respect that everybody who's received it or considering it really wants to hear what comes out of tomorrow's discussion. So I'm eagerly awaiting, and hope you are as well.
Thank you, Jean, and thank you, Alfred, for your question. I'm sure I can speak for everyone that, of course, if you did get J&J vaccine and have any symptoms, you should immediately call your healthcare provider. With that, I'd like to welcome Natalie from West Wyomissing onto the line. Natalie, you should be live.
Oh, hi, everyone. Thank you for the valuable information thus far. Really appreciate it. My concern and my question is, what can we all do, as you have positions of leadership and as a community, to get people who are hesitant to get the vaccine, more due to their political views on freedom and independence, than rather than looking at actual science? I mean, it's very hard to convince people. I have an aunt who lives in Texas. She's 83. She's a registered Republican, and as the statistics are showing, she's very reluctant. She doesn't trust it. And it's scary, because people like that are at risk, and other people are at a risk because of it. And I just wondered if there was anything that, as a community, could be done to further educate people and persuade them.
Connor,
Thank
if it's
you,
okay,
Natalie.
I'd like to try that question.
All you, Congresswoman.
Thanks, Connor. And I really do appreciate the question, and very much the spirit with which it's asked too, because I know that as you love your family, I love mine, and we don't all necessarily have the same way of approaching the world. But this is one of those things where we can leverage a lot of different ways of getting people to try to understand just how important it is to take care of themselves and take care of their families, take care of their communities, take care of the country, take care of the planet, because we really are all in this together. And so some of the things that we can do is things like this, right? We can have, open conversations where we're trying to make sure we're delivering good factual information objectively. We can have conversations with each other on a personal level, on a familiar level, where, as an example, for most of my life, my mother was a Democrat, my dad was a Republican, and they went together to the polls and they voted and canceled one another out. But my mom would be right there talking my dad into, making sure that he was listening to what it was that was important to her. So hopefully we can, be talking to each other and having those conversations as this vaccine and the several vaccines that are available become more prominent, and more prevalent. Perhaps people will become less resistant or less reticent and more interested in going ahead and taking care of themselves, and also, as I mentioned, of their families and of their communities as well. So it's a combination of processes. There are other things that can happen at the federal and state level as well that we can do to try and incentivize people, including things like that President Biden has just recently announced a tax credit for employers who are offering vaccine-related paid leave. So many people, frankly, don't have the opportunity to leave their workplaces for hours at a time to meet specific appointment times. And so this is an opportunity that the president has offered to incentivize businesses to provide those opportunities for people who aren't necessarily resistant, so to speak, but who may not have the time and the bandwidth to be able to do that. And so those are some of the things that we can do at the federal level too. We also have some different pieces of legislation, one of which that I'm reminded of is the Community Immunity During COVID-19 Act, which helps support local efforts to boost vaccination, routine vaccination. This isn't just COVID vaccination, but other sorts of vaccinations as well. So we have all different ways of talking about this, and that's kind of one of the reasons why I wanted to talked specifically about the fact that, yes, we need to make sure that we're bringing mobile clinics to places where people don't normally have access to this vaccine, but we also need to be having those conversations with people who we love, who may or may not be quite as willing as we are, to consider this opportunity to take care of ourselves and each other. And I hope that those conversations will make a difference with each other as well.
And Connor, this is Randy. If I could weigh in on this one as well, there has been a significant amount of discussion at the state level regarding this. And the discussion is really centered around government is not necessarily the best messenger for this. Because of individuals' geopolitical views. And it's really constructing a plan, which the Department of Health is working on right now, finalizing, to be able to leverage influencers. And really, it's about the message, but it's also about who's delivering that message and how they can identify with the population that they're actually delivering that message to. And that's really key. So I think over the next number of weeks, you're going to see a lot of things coming out from the state where they're going to be leveraging influencers like sports personalities, but also taking a look at, the populations that are going to be harder to have discussions with, to be able to find out the best ways to be able to do that and to be able to work through existing channels, within the community, to be able to leverage and pull those levers and tools to be able to reach those people that have a good conversation with them and really kind of take the politicization of, the vaccine and everything that has occurred kind of out of that context to be able to really work that side of it. I think this is a very good question, and I think it's something that we've given a lot of thought at the state, and we also understand from a government perspective we are not necessarily the messengers that people want to hear from when it comes to this.
Yeah, if I could close that question by saying, and this is Chrissy again, we each individually are influencers in our personal lives. We lead by example, we speak from experience. And we can each make a difference in the conversations we're having with people we love.
Thank you all, and thank you, Natalie, for your question. We have time for one more question. Of course, there are still more in the queue. As I think I mentioned earlier, we had about 3,000 at our peak on the line with us, so there are still tons of questions. Please remember that someone from Chrissy's office will get back to you with an answer to your question within 48 business hours. With that, I would like to turn it over to our last question of the day. And this is Dorothy. Dorothy, you should now be on the line.
Okay, great. Thank you. Hi, all. My question, I think, is for Jean or anyone that's more medical there, myself being a health professional. With the COVID vaccine, when somebody's fully vaccinated, going forward, do you foresee us needing a booster and a yearly vaccine like you would get with the flu vaccine?
Thank you, Dorothy, for that question. And I will hand it over to Jean. We got a number of these, so I wanted to hand it over to you.
Yeah, that's an excellent question. So when it comes to needing a booster, we are starting to hear that Pfizer may be they're trying to finalize, is it going to be necessary, a booster? Clearly, with seeing how the nation responds to this vaccine from an effectiveness standpoint is going to help drive that. So right now, someone fully vaccinated, meaning 2 weeks after their last dose and up to 3 months since that last dose, they're considered fully vaccinated. We anticipate as more people cross that 3-month period and their protection persists, that will also change to say, okay, now that you're 6 months post-vaccination, you're still covered. So we need to get through some of those milestones and have the science and the research say, is that effectiveness still holding up in those high, mid 90% that they started with? So that's one factor. I have always considered this virus and its related vaccines to be a good candidate because it tends to have seasonal cycles to become one of those annual. We even hear research where our vaccine experts are already trying to combine an influenza vaccine with a COVID vaccine, much like you have other combinations of vaccines for the childhood years. So I love that they're already forward thinking that and taking advantage of what we already know in our, our science and our immunization and vaccination world. But we won't know that. I'm going to guess, and this is purely a guess, there's no science behind it. I'm going to guess by the end of this year we'll hear a little bit more, particularly because we're going to go into another warm season and cold season, and we will have 2 seasons of each type, warm and cold, to reflect on and actually measure the effectiveness of the vaccines. So I hope that's helpful.
Thank you so much, Jean, and thank you, Dorothy, for your questions. With that, we are coming to the end of our town hall. I now like to hand it over to Congresswoman Houlihan to bring it home for us.
Thanks, Connor, and I really want to thank all of you all who have joined us in this call for any portion of the time that you've been able to be with us. I want to thank our panelists, Randy Padfield, Jean Franklin, and Brian Gottschall, all for joining us today, and to thank all of you who had really excellent questions. And for those of you who had questions but that we were not able to get to, a reminder that a member of our team, our staff, will be able to contact you directly within 48 hours with a follow-up and an answer to your question. We will be able to send you also a recording of this town hall to our email list. And if you have not had the ability or opportunity yet to sign up for our email list, I would really encourage you to do that. I think my team does a terrific job with that. And the way that you can do that is to sign up for that at houlihan.house.gov. My name is spelled a little unusually. It's HOULAHAN.house.gov. And that's a place where you can sign up for regular newsletters. We will also be posting it to our website. And I definitely encourage you to share this with friends and with your neighbors. It's part of the conversation that we're having about how to spread the word. And as always, my office belongs to us, to our community. And so if you have any questions, please do feel free to reach out to my team and I. You can call us at 202-225-4315. Again, that's 202-225-4315. Again, I'm incredibly in awe of our community and incredibly proud of the work that we've done together to make it through this pandemic through the last 15 months. I'm very hopeful that we are on the other side of this, or at least trying to come out the other side. I would encourage you to continue to do all the things we know that are correct to take care of one another. Thank you so much, and please stay safe.